Hello, welcome back. We are still in the section on our military members who are experiencing grief loss, um, approaching grief, coming home with grief. And today I am, and I do mean this honestly, very honored that my dear friend Haiping Hwang-Twigg has agreed to be interviewed. Haiping has served in our United States Air Force and along with her husband, and they served around the world. And she has a wealth of experience, and she's also done mental health and substance abuse treatment in the military. So you are going to hear from someone who has been there, done that, has the education, and can share that with you. So we're going to just talk about it and let you glean all that you can from what Haiping has to say. Haiping, thank you for being here. Could you introduce yourself?
Yes, I'm Haiping Hwang-Twigg, retired tech sergeant from the United States Air Force. I have a bachelor's degree in psychology and sociology, a master's degree in human relations. The jobs I've held in the Air Force, I've been a mental health counselor. I have been a drug and alcohol counselor, some of which I've done at the military federal prison at Myanmar. So I've seen all sorts of clients in many, many different environments.
I remember you talking about actually being part of flights out to get people out of the fields, not quite in battle, but to who had become addicted and needed to get to treatment.
Yes, one of the things is that within the military, drug and alcohol treatment and mental health are done together, which I think is a really good thing because it isn't just drugs and alcohol, and it's just not some mental health disorder. So I'm glad that they do that. Many years ago, we used to do 28-day treatment programs, but unfortunately, that's kind of gone away, and a lot of it is outpatient, or you just get kicked out of the military with no treatment. So I think one of the things, especially for the drug and alcohol treatment, we always find people who start out in mental health, but we do find underlying substance abuse things, and particularly in the federal prison, that they came in with a charge and they're sent to mental health for evaluation, and we find out really the bigger problem is drug and alcohol.
And that's caused the behavior that's caused the charge.
Yes, yes.
Yeah. Can you talk a little bit about, now we are an older generation, um, but what the training is or was for members who are just joining in terms of how they are taught to cope with facing loss, facing trauma, facing loss of comrades, facing loss when they get home. Is
Well,
there training for that?
well, it's very interesting. I kind of thought about that before this interview. And in my 20 years in the military, I cannot remember any kind of training for any kind of loss. Of course, I had it for my job. I had those kind of training, but as the regular service member, I can't remember having a class, a training, a briefing. It really it just was not mentioned. It's just you went about your job, do your job, and then you come home, and whatever is happened within that job, it's usually not very, it's not mentioned. The only things that I will say is that if we had some kind of incident like hostage situation, we would do critical incident afterwards with the providers, but not the actual people who were in the incident. That happened several times.
Oh my
So
gosh.
yeah, it very strange. Grief is, it's almost like not considered a subject worthy of addressing, training, or anything like that, which I find it very unfortunate.
Yeah, because it leaves a huge gap.
Yes, yes. I mean, I think about one of the facilities I worked at, our offices were on the second floor, and they had this huge staircase that came up, and people would know if you're walking up to the second floor, you're coming to the mental health offices, or you're not going to the administrative offices. So, it was very much, people are staring up the stairs thinking, oh, why are they going to mental health? And, it's fearful for most military members to go to mental health and even talk about personally what's going on, if they're grieving for another service member they lost. It is, I think, service members fear because, yes, there are medical records and yes, there's HIPAA on them, but there's always a notion your commander can go and take a look at them. And so most people, if they do have issues, they're deep issues, they're critical issues, and they've gotten to a point where they have to go to mental health. But normal things like, even grieving, a loss of a parent, you would
Right.
not go to mental health, even though you have grief, because you don't want to have a mental health record. You're, of course, your supervisor, you will say, hey, I have a medical appointment. And then if they ask what kind, which they're not supposed to, but they do, and you say
Right.
mental health, and that actually, subconsciously does
Creates a
work.
stigma around you.
Yes. And when it comes to your reviews every year, that still is in the back of the supervisor's head. They take too much time off from medical appointments. That is usually how it's written.
Oh,
So it's, it might not even be, it might be that, my mother passed away and I'm having a really hard time. And yes, I go to mental health once a week, but the supervisory side is looking, they go to an appointment every week and they've been doing it for 6 weeks. So it's very, I think the thing is, it's hard to seek mental health. I have a good story about this because they always said when you first come into the military, don't say anything that you've had any depression or any kind of mental health disorders or anything like that because you won't make it. Well, I was in basic training many, many years ago, and I came into the military a little bit older. And about the 4th day, I had not had a full cup of coffee. I was tired. And we're doing this process of interviews, and they ask you, are you feeling depressed? And thinking about that coffee, I'm like, yes. And so they immediately shuttle me off to the mental health department. And, I'm kind of scared thinking, oh, I've only been in the military 4 days. Am I going home?
right.
And I spoke to a civilian mental health provider, which I think service members are more apt to speak to civilians versus someone in a uniform being a counselor. So this older gentleman, and he said, hey, what's going on with you? I said, I haven't had a cup of coffee in 4 days. I haven't seen the news, and as a older recruit, I didn't understand, these cup of coffees were very important. And, the gentleman, he was a psychologist. He goes, would you like a cup of coffee? And my eyes lit up and I'm like, of course I would like it. And then so he goes out of the office, gets the coffee, brings me a newspaper. And I sat there for, 30 minutes reading that paper and drinking that coffee. And just that little
The
bit was
intervention.
perfect. Right. So then, I go back to my unit and everybody's looking at me. The TIs got eyes on me just all the time. And I felt that way for the next 6 weeks, that they were waiting for me to, I don't know, explode or have a tantrum. And so that's the kind of stigma it has. And all I did was have a cup of coffee and read a newspaper. So I think
But can you
people who,
imagine being the one who's just lost a parent they're on the other side of the world?
yes, yes. And a lot of times you can't, you can't leave wherever you're at. And I've seen many times co-workers, people I know in the Air Force, and something that, some kind of death, and there's just no way to get back. I will say, luckily, the Red Cross really does step in for that, and that's nice. But it may be you get to go home for 3 days, and that's it. And that's certainly not enough.
No, that's a drop in and drop out.
Yes.
And then you got to
Yes.
seal it all back down again.
Yeah. I would say that these Gen Xers, I love them, but the Gen Z are really being more proactive within the military about speaking openly about whatever they're going to speak about, whether it's grief, whether it's, job dissatisfaction, different things. Gen X and boomers were just too set in our ways of, this is, that we're ingrained in 40 hours a week, having seat time at your desk, doing your job, regardless if your limb has fallen off, regardless if your dog died, you just sit at that desk 40 hours and you do what you do.
Right.
The Gen Z, I really admire them. And I would hope that within the military, the Gen Z has made it easier for people to go seek mental health services, for regardless of what it is.
I think we're going to need the next generation to actually make that happen. They're starting to make the waves, but
Yes.
I don't know that we're going to make the changes yet.
Well, because there's still a lot of Gen Z supervisors, leaders within the military.
That's exactly right. They're still there. When my wife Stacy was a child and her dad was military, she fell down a lot. Like, she was one of those kids. And so it got to the point where if she cut herself open, she waited for him to get home and he stitched her up, because you got looked at twice if you used military medical facilities too often. It was just, be quiet, suck it up, keep going.
Yeah, I would say that's still the case within the military. You don't want too many appointments to mental health. In fact, you don't want any appointments to mental health, even though they encourage it. We have big to-dos about Suicide Prevention Month, and the different things for the drug and alcohol, and they promote them, but they aren't really reaching the actual service member. I almost, in many respects, feel like it's for show, to see that, oh yes, we did Red Ribbon Week,
Right.
and we had these promotions, and see these events that we did, and it's for the numbers, but is it reaching people who actually need the help? Are the people able to access the help? The mental health is there. You can go, you call, you make an appointment. But there were times that we'd have, I don't know how many providers. At this one clinic, maybe we had 5 providers. There'd be days, their days were not full. And I can't imagine in any civilian kind of atmosphere where they would have appointments same day available for mental health.
No. Mm-mm. 6 weeks out, maybe.
If you're lucky.
Right. And at the VA, weeks out. But
yeah,
the active duty folks, they just don't feel safe.
They don't. There's a lot of fear of retribution, and I would, in my mind, I think if anybody were seeing a military member, I would expect them to come in and give you very little of themselves, give you very surface kind of things, and that you might, if you just took it for that, you'd be like, okay, I think you're going to be fine. I'll see you in 4 weeks. But in reality, there's a lot underneath, and it could take a long time to break through those walls. So I'm sure it would be very frustrating thinking, okay, this guy comes in and says, yeah, he feels a little sad. And then he doesn't even tell you why he's sad. And we find out that, besides being in the military, he's been caring for his elderly parents, and one of them has passed away, but he isn't saying that. And so I think it's hard. I think I think probably you have to push, but gently push,
Mhm.
because there's just so many things that they wouldn't do, if they were in a military mental health facility. They wouldn't say anything. And many times, I've interviewed people for intakes, and if I actually just took the information that was provided to me, I would be like, well, there's no reason why this person needs our services, but yet they came. So why is that? And so that's, I think, maybe what makes first responders, military people, a little bit harder of a nut to crack.
Yeah, because they don't want, they're taught not to admit, and admitting is, that sounds like it's a crime or a guilt or they're not given permission to be able to acknowledge the emotions.
Yes,
And that the
yes,
emotions require support sometimes, and they require support and deserve it.
yes, I agree. Unfortunate, really thinking about beforehand, thinking about grief training, grief services. And it's such a shame that really there's none. And if there is, it's pretty hidden away.
Right, right. I mean, even if you go to a military service at the national cemeteries, it's 15 minutes and
Yes.
you're done. Thank you for your service. Thank you for being here. And they're dignified and they're lovely, but it's 15 minutes.
Yeah, it's everything, because they have to move on to the next.
Right, which is the way it works.
Yeah.
And
It,
and if you're leaving a duty station, you leave behind everybody you had there.
I think about that because in this day of smartphones, computers, FaceTime, all the different apps, it is so much easier to get connected with people. But in the very early days of the military, I'm pretty sure we didn't have email. We
Mm,
did not have smartphones. Um, and oh, I remember I used Skype, which was a very new technology. Um, and it wouldn't always work. And also, too, there are many places where if you're at a hardened facility, you've got internet, you've got electricity. But if you're going out to, for example, I was deployed to Cuba for a time, and there was no internet. There, we barely had electricity, and we were intense. So you can't keep contact with anybody, and it's very difficult. I think even that is a kind of grieving, like grieving the contact that you have
right.
with people normally, right? For some,
Grieving the knowing, the being able to keep up with things with you had a child.
yes. So it was very difficult, and I think, you know many military members, I think they kind of suffer from micro grief. So these small losses. So it may not have been one big event, but all these small things, like I had to move away from my base. I had to move away from my family. I'm here with people I don't know. I got written up because I didn't know the schedule. I mean, so many little micro griefs, and those things add up, and you need a big basket to carry it, and some people's baskets are very small. So,
They don't know what to do with their baskets and they don't have help for them.
yes, yes. So,
And so if
yeah,
they show up with one of the people in this class trying to help, maybe even after the fact, they need permission to be able to open it up.
yes, I honestly think that military service people need a different kind of patience, because they're really good to do what they're told to do. Like if you give them some grief homework or some kind of, self-awareness homework, they're going to come back and it's going to be done. It may not be done in their true self, but it'll be done. So I think like written work is not very useful because they'll get it done and that won't be a problem, but they're just checking the box off like, okay, I was given this, I've completed it, here it is.
Following
So
orders. Hmm.
yes, I think more talking and in more of a casual way is better, because if you're saying, okay, well, I heard that your mother passed, and how's that going with that? Well, yeah, that I think a more conversational tone is better because they've got to actually be able to trust you and
Mhm.
trust you well, because most military people don't trust anybody. So, especially medical providers.
Exactly right. And that's really hard because with mental health now, there are so many insurers. So far, TRICARE hasn't started, but I'm sure they will. They now have programs which are AI generated and determine if you're making progress fast enough based on self ratings. So the client comes in and they have to use an iPad and do a self rating that takes between 3 and 7 minutes. This stuff is timed. And then there's a trajectory based on the answers built into the AI that tells the insurer how fast someone should recover from whatever their symptoms are based on their answers on the iPad. Well, someone who's been taught not to talk about feelings and not to recognize them is going to have a far different rating than someone who is all about the emotions. And then they're going to be expected to be finished sooner than later. And the therapist is going to be told you're taking too long because this person doesn't rate themselves that seriously. When in
Well,
fact, what they really need is to talk.
I I I find that just so interesting because I would say a new military person coming perhaps into a civilian mental health organization, and if they were to do something like that, I would say 90% of the responses would be unreliable
Right.
because yeah, unless that military person is at the very bottom, they're at their wits end, then you may get a true, you know, true reflection of what is going on. But just the person who may be trying to deal with some depression that came from grief, you would not get a true representation. Wow, that's terrible. I think that's
It's
awful.
terrible. And it's going everywhere. There's at least four major insurers now using that, some kind of process like that. And it's crazy town. And some of them are also now saying, and you are only to get the client to 80% of better because they are expected to finish the last 20% on their own. But when you're working with people who are on the front lines who are taught not to let anybody in, that last 20% is where all of it is.
Yes, yes, I agree. I definitely agree. It, it's interesting. It's not least for active duty service members, access is not the problem. We've got access, we've got appointments, and but it's actually getting people in. It's like I
Say
think,
they I need.
right. And, I kind of feel like, if I had one of those road signs that I would wave, hey, come into mental health, maybe I attract more people. But there are days it's very slow in a mental health clinic. And so, and I think military providers have a problem too, because they're trying to figure out, does this person really have a problem, or are they malingering? Which is
Right.
which is a big deal in the military. Malingering, you'll get you kicked out of the military.
Mhm.
So I think it's hard to be a military provider because you still have the Air Force telling you, okay, we can't have malingerers. And then you have to figure out, well, are they really having some issues? Are they just doing this to get out of whatever they want to do? I don't know. Um,
Are they Corporal Klinger or are they really having this sadness and grief and they need some help?
oh my
Right?
goodness. Yes, exactly. But
Right.
I
And I love
definitely,
Klinger, by the way, but yeah, that's sort of the classic example of malingering.
yes, I think I think most people, I think anything conversationally works better than having your treatment goal. And these are the steps we're going to do to get to that goal. Because most military people follow the steps and get to where they need to go and be done, but
Mhm.
they've gained nothing. Um, Workbooks, I don't know. I'm thinking workbooks, not great, but I think more conversational is really the
Making it a
way to
safe
go.
space. Yeah.
Yeah. Yeah. Just to say whatever they got to say.
Absolutely. What things would you have wanted if you were active duty? You've had losses in your life that might have drawn you more into accessing, or was there any way to make it safe enough given that you needed to protect your service record?
There is nothing that I think would have made me more comfortable because it's still part of the military record. Many people pay cash and they go
Right.
to seek providers out on the town, and they
Mhm.
make sure it's not exactly in their town, maybe a couple towns over, so no one sees their car parked in front of the office. Um, Unfortunately, I think that's still the way. If you have ways to pay cash, you go and you go seek help for whatever issues you're having, and you eat the cost. And there's no reason. I mean, there's honestly no reason, but the fear that the military is going to see what those records are and then they're going to do something about it is it's not unfounded.
No, it's not. It will prevent you from being promoted and it will prevent you from getting clearances.
Yeah, so to me, you know, you have to play like you're sane all the
Mhm.
time, even if you're not. So, good cover face, military folks um who do seek mental health, they really do. They've got their little face shield on and everything is good. And then you don't know what kind of suffering they're having, on the job. The supervisors don't know, their friends don't know because they don't want to jeopardize their job.
What about at home? How does that work when you go home from life in uniform and you walk in at 7 o'clock at night and you've had one of those days, or you've just flown in because you've just finished something? How do you leave the cover? Is that possible, or is that something that has to stay in place?
Well, I think in many times, if you're living in military housing, you got to keep the cover because you got neighbors and they're close. There's no yelling or just, doing different things because your neighbors are close as the next wall over. So, but what I have seen is that if they do take their cover off, and then we end up seeing a lot of domestic abuse, a lot of child abuse, self-harm, and it's very unfortunate. The military has a huge domestic violence program, um, and it's someone who may or may not have a stressful job. It's their stress, regardless of what it is, and they come home and they just unleash it on their family.
Mhm.
Um, it's awful. I think there's more participation in that because commanders can mandate domestic violence treatment, unlike mental health treatment. So now your commander's involved. You've blown off. You got wild, and you just were, being very verbally abusive to your spouse. You're in base housing. The neighbors heard a fight. They called the base police. And that's where the commander is in charge of all your treatment, regardless of what's going on. So, yeah, yeah.
You really have no space.
No, and that's why many people try to move off base, which once you're higher in the ranks, it's much easier. You make a lot, they give you a housing stipend, but sometimes it's not enough to live in the community. And so
Right.
you see a lot of younger airmen who are living on base because that's really what they can afford, and they living in tight quarters. I mean, they're like, if you're married, have a spouse and a child, you probably get a 2 bedroom, and it's apartment, like it's not really awful. They give you utilities, but if you had a bad day on the job and your underlying reason was, you found out you have to go for a year without your family, and it's
Right.
causing some stress. And so there that it it's very interesting the way people tiptoe around mental health services, within the military. And so when we do end up getting members who come in, they're in terrible trouble with themselves. They just can't figure it out, because if you're kind of, not feeling great, you just don't go. So you end up having much more complicated cases for many reasons.
You wait till it's a crisis.
Yes.
Absolutely. What are some of the ways you see that grief, what kinds of grief do military members experience? If you were to give a list of them for the class to think about.
Well, I think grief of your buddy who was right next to you. There are many jobs in the military that are not out with the gun, out with the tank. But here's one, for example. I was working in an inpatient mental health clinic, and I, doing room checks in the evening. I walk in and I see a patient hanging themselves. And we get him down, he's okay, but we never really even debrief that, which I think is so strange. Like,
Wow.
Yeah. And so even like office workers, people who work in the offices or even in the hospital, I imagine within the hospital, if you're working in the OR, you lose a patient, I don't think they debrief that. So it's easy to see the ones when you're in a war zone. You see the people who get blown up and things like that. So those things I think are treated very differently, but everyday things, I remember having a friend of mine, she was working on the electrical lines, electrocuted and died, but there was never any debriefing for that.
What?
So it's a very strange thing. I suppose they are looking at things, if you're in a tank, they're bombs, they're guns, and those are the obvious ones. But within the military community, it's like a little city in itself. So yeah, I don't really know the electrical guys on, that work on my electricity, but most likely on a base you do.
Right.
We have full-fledged firefighters that are doing all sorts of fires, and we're very close. So I guess everything that happens in your own little city happens on a military base, but most likely you will know that person, or someone who knows that person. So those are the things that I think just kind of get, left behind, because, yes, we had a policeman down the road who got shot at a hostage situation. Well, most likely, if you're in the military, who happened. Yeah. So I think that's probably some of the grief that you don't hear about or see about, because it truly is such a small community, and but it runs like any other city. So
it absorbs itself inside that community. So you've got frontline people inside of frontline people. You've got subsets under that.
Yeah. So, and I think there's, there's a lot of, there are people who work within the base. Everything you have in a regular city, we have on a base. And so, but it's like you got a directory and everybody in this city. We know that doesn't happen outside of the base. So I think it's just everyday things are very magnified. Things get very, like, news travels fast. So one of the base firefighters were hurt, doing a brush fire on the runway. Okay, well, I probably knew about it probably within 5 minutes. And
oh my gosh,
I mean, it's fast, because someone knew someone who called this person, and so news travels fast, regardless, good or bad. And I think for military, it's just it's the things that aren't recognized, because someone gets shot and killed in a war zone. Okay, people expect that. We're in war. So it's really obvious, but I think it's the small things that you don't see. Um,
And the news travels fast and then you can't do anything with it because
correct.
you can't acknowledge the loss because that's just life.
Right. Right. Yeah. Yeah. It's just kind of one of these things. Well, that's the way it is, and press on.
Right. Someone drop off a casserole,
Right. Right.
right? So it's doubly magnified. And then when
Yes.
someone retires, all those stories go home with them, but nobody else other than someone they served with is likely to have any awareness of it or empathy for it.
Though I will say, once a person retires, whether they use the VA hospitals or if they use civilian health insurance, those things tend to come out afterwards because they don't have to worry about the man. They don't have to worry about promotion. And it is very interesting that you see the retirees using services much more than they did while they were in the military.
Absolutely. Absolutely. But even then, it takes a bit to get them in there
Yes,
because
yes.
you've been, especially if you're in the older generations, you were taught to buck up and keep going.
It's all you do. Here's Band-Aid.
Right. Right. Yeah. I shared this with in another class session, but we had a significant number of men in our church who were World War II vets and had served in the German theater in the army, boots on the ground in the winter, like as bad as it gets. And when they would be acknowledged on Veterans Day in the service, several of them just stood and cried. And they couldn't even put words, but they were remembering. And one of them finally said, I just can't get that field out of my head. The
Oh my,
sights, the sounds, all of the PTSD was so profound. And he was 85 years old at that time. And it was still there,
yes,
just as
because
profoundly.
wasn't able to really work it out for themselves.
Mm-mm. No, and wouldn't discuss it with his wife, who would have given her eye teeth for it, because that's not what you do and you don't want to traumatize people who weren't there,
Correct. Correct.
right? So it may be encouragement for folks once they have retired to get them into care, right? And to find some access points that way. Thank you, Haiping. I really appreciate it. Do you have any wise words for this course? These are people who are educated, skilled, talented, and in all the walks of life wanting to do work in grief.
I think working particularly with military people, you have to be a very keen observer. Um, Maybe less words is better, but if there's something that, because if they're gonna if they're seeking help, they need help, but they may not be able to put words or emotions to it. But I think observing keenly of maybe something they mentioned more than once, and maybe that's a starting point. And I think being very conversational is one of the most important things. Homework, they got it. They're going to do their homework. Kind of a waste of paper and time. So
Need you
I
to hold the space and give them the safety.
yeah. So I just say be conversational, be patient, and good luck to everybody.
Thank you for being here. I'm going to turn off the recording.